125,000 Americans die every year due to medical non-adherence. 60,000 Americans would be saved each year if coverage was to be expanded.
Let's look into a country that has secured the benefits and advantages of nationalized healthcare. Canada has decentralized, universal, publicly funded healthcare system called Canadian Medicare. Total health expenditures of the public and private sectors account for about 70% and 30% respectively.
Nationalized healthcare would allow the average American family to see the positive annual savings of $2,400 that would have otherwise gone to their treatments.
So what escalated this issue? As all things considered, the coronavirus pandemic has made the shortcomings of our current healthcare model more apparent. The number of Americans without healthcare support has risen from 30 million to approximately 73 million. With such a large portion of the US population without healthcare coverage, new steps need to be taken. The immediate response to this would be to move into a more nationalized healthcare system. Studies have shown that the average American family will see a positive annual savings of $2,400 that would have otherwise gone to their treatment. Every extra dollar in the pockets of the 53 million low-wage workers would add billions of dollars to the national economy annually. However, the shift to a nationalized system of healthcare would lead to an influx of new taxes.
If we take a look at privatized healthcare in the United States, we see it's the primary healthcare option for 67% of Americans, many of whom receive this form of private insurance from their employers. In 2018, 30 million Americans were without any form of health insurance. This has gotten even worse with the coronavirus pandemic. Governments would also provide a lot of funding towards national health care. From 2018 through 2019, there was an upwards of $3.8 trillion put into the healthcare system. This represents 17.7% of the nation's GDP. Just think about the impact that has on the population. Nationalized healthcare would also allow workers to switch jobs as per their preference, as currently, employees are unwilling to switch jobs at the risk of losing their health care. Around 864,000 people are discouraged from switching their jobs due to this, which leads to a loss of $1.8 billion annually. By eliminating this job loss, the average employee would see their wages go up by 30%. Every 1% increase in wages would increase consumer spending by $2,800, reducing income poverty by almost 4%. Insufficient income has caused around 291,000 deaths in the United States. We can avoid this. The citizens should be allowed to spend less on medicine and more on their well-being.